Welcome to Medicine Redefined, a podcast focusing on helping you reclaim ownership of your health. I'm Dr. Darsha.
And I'm Dr. Altamash Raja. We're your hosts, here to challenge conventional practices and uncover the stories behind pioneers shaping the future of medicine. Our conversations not only focus on the individual level to dissect common practices for health optimization, but also zoom out to enhance systemic change.
Join us as we look to break the status quo, move the needle forward, and put the health back in healthcare. Our guest today is Dr. Leonaura Rhodes, a distinguished physician, public health expert, neurotherapist, and certified brain health coach. With over 3 decades of experience, Dr. Rhodes has dedicated her career to helping individuals optimize their brain function, manage stress, and design fulfilling, high-performing lives. Dr. Rhodes obtained her medical degree from the University of Manchester and later pursued a master's in public health at the University of London, where she trained in biostatistics, epidemiology, health economics, health promotion, and medical writing. She further expanded her expertise by obtaining numerous certifications in counseling and neurotherapy. Additionally, she completed intensive coaching training at the Tony Robbins Coaches Academy, equipping her with a broad skill set to help individuals improve cognitive health and resilience. Throughout her career, Dr. Rhodes worked as a general practitioner, public health physician, and neurodevelopmental pediatrician, gaining extensive experience in neurological and cognitive health. She has since transitioned into coaching, corporate training, and medical writing, focusing on stress resilience, neuroplasticity, and brain health optimization. In this episode, we are going to explore neurodegenerative diseases, the lifestyle factors that influence brain health, and practical steps to protect cognitive function as we age. Throughout this episode, you're going to learn about how we can understand what neurodegenerative diseases are, their causes, the progression, and similar common types such as Alzheimer's, Parkinson's, and vascular dementia. We'll then go into the role of genetics versus lifestyle and how we can prevent cognitive decline. You'll also learn about the power of exercise, sleep, and diet when it comes to maintaining long-term brain health. We'll also talk about how stress, inflammation, and gut health can contribute to neurodegeneration. And lastly, we'll also talk about insights on supplements such as creatine and their impact on brain performance. This is a wonderful episode. I can tell you from firsthand experience in the rehabilitation setting, I'm seeing more and more patients with neurodegenerative diseases. So I know this is something that is going to hit home for all of us. Let's dive in. Welcome, Dr. Leonaura Rhodes.
I'm so glad to be here. Thank you for inviting me.
Yeah, it's always a pleasure to have guests that, I've spoken to you prior, but it's always fun to have a friendly, familiar face back on the podcast here. Let's get right into it. We're going to be talking about neurodegenerative diseases as well as the lifestyle factors. This has been a hot topic on social media lately. There's been a lot about brain health that has been coming out. But for our listeners, why don't we just start with the basics? What is a neurodegenerative disease? And can you provide some examples for us?
Totally, yes. So neurodegenerative diseases, which is hard to say, is a group of diseases that is marked by an abnormal or escalated death in brain cells, which sounds dramatic, but basically the brain is aging faster than normal. And it inevitably leads to a significant reduction in brain function, cognitive decline, and loss of normal function, and ultimately the ability to be independent. Interestingly, neurodegenerative diseases usually don't cause early death themselves, but they do cause early mortality through the side effects of the disease themselves. Some examples you'll all have heard of. We have Alzheimer's disease is the most common. Not many people have heard, lay people have heard of vascular dementia. This is the second most common of the neurodegenerative diseases. Parkinson's disease, which is more well known. Then we have multiple sclerosis. Another one that not many people have heard of is Lewy body dementia, frontotemporal dementia, ALS, and Huntington's disease. They're the kind of top 8 of the neurodegenerative diseases. And they all cause slightly different symptom profiles. Some of them are associated with more musculoskeletal symptoms, difficulty walking and things like that. And others have more of a prominent cognitive or thinking, memory dimension to them.
So you mentioned, how these diseases are not only just isolated to the brain,
there is that cell death that we see there, but it is pretty much systemic. And everything that you mentioned, man, this is bringing PTSD probably for all of us when we're studying for boards. It's CAG repeats in Huntington, the Lewy body, and the vascular dementia, the stepwise decline that you see. These are all things that we had to learn. Not much that I see them, at least in the clinic. I definitely see a lot of Parkinson's. I've seen ALS, dementia, just as a whole we see. But what are those early symptoms and signs that we see in these disease processes?
I think herein lies one of the problems. They're often pretty vague early on. And we have three phases with all of the neurodegenerative diseases. We have a preclinical phase where people might have some really subtle symptoms, maybe a bit of memory decline, which, it's funny, I'm in my mid-50s and I've spent time with, we went for a weekend with four people in their late 50s a couple of weekends ago. We spent the whole weekend saying, remember that guy who was in that movie that played that role? We, not being able to remember names, that those kind of memory lapses that people have. And, in these diseases, they are at a higher level than they are, in the normal aging process. But it can be very hard to discern what's normal aging and what is more significant. Also things like mood change, personality change, and then, of course, with, say, Parkinson's, Huntington's, and Lewy body, we also have some physical symptoms as well with, problems walking or tremors, things like that. So early on, it can be very difficult to, in the preclinical phase, to know what's going on, and it can be hard to discern from what's just normal. And then we have a phase that is certainly in Alzheimer's is called mild cognitive decline, where you're starting to see more significant symptoms. And in these first two stages, this is where we do have a window of opportunity to actually, slow the progression of disease through lifestyle change, which we'll come on to talk about in a minute. Sadly, by the time most people are diagnosed, the disease process is at such a significant level that current treatments are not able to halt the progression of the disease. And then we are relying on symptom relief.
That delay in diagnosis, what do you attribute that to? Is it the vagueness of the symptoms and there's overlap with so many other things? Is it access? At least, I'm sure the answer varies in terms of the access answer, depending on which part of the world you're in. But considering we're all practicing in the States, at least, where also there is some disparity, but what would you think here the reason for that is?
I think it is a combination. It is going to be largely down to people not seeking medical care, it's very frightening when you think you have early symptoms of these diseases. And, especially I'm of a generation where we did go to the doctor more, but my parents' generation were very stoical and would delay going to the doctor. There's, I frequently hear from that generation, didn't want to bother the doctor. And so often, they'll be ignoring symptoms for months or years before they'll seek medical care. And, if they do see their doctor for their routine medical, they may forget to bring these things up. Years can go by of symptoms being missed. You then have people at the other end of the spectrum who are a bit neurotic and who go to the doctor very early. But then you have the problem with, sometimes doctors not taking things seriously, being, fobbed off, saying to people, don't worry about it. It's normal. You seem fine to me type of. And then, of course, access to seeing a specialist. This is a specialist diagnosis. This is not something that's made by a primary care doctor. It's usually made by a neurologist or a neuropsychiatrist or neuropsychological evaluator. And the testing, the in-depth testing that needs to be done in order to make an accurate diagnosis is very expensive as well. We're talking about thousands of dollars in treatment. And for some people, that is prohibitive.
Right.
Yeah.
It's interesting you bring up the story about parents' generations and bothering the doctor. I actually had an interaction with a patient today where she was looking forward to meeting my resident's or in sharing her story. But I didn't have any trainees. So it was just, hey, just me today. And she kept saying, I'm sorry, I know your time is really valuable and I want to try to get it all out. And for a moment, I felt so bad. And I was like, is it, what is it about this interaction? I don't feel like I've ever given off this vibe that, I'm pressed for time. I feel like I do a pretty good job of sitting down and listening to all that kind of stuff. But I think it's just that generational gap that you had talked about where you feel like you are a bother with your symptoms, with your quote unquote issues that you might be bringing on. And so that's really interesting. What about, I think one of the things that we talk about often in medicine to be able to recognize these things is, different disease patterns will present in different stages of life. And so age of onset could be an important thing that we always consider. So if we were just to take some of those top ones that you talked about, so you said Alzheimer's, vascular dementia, I think you said Parkinson's might have been a third or fourth. I think Parkinson's, in my experience, may be a little bit easier in the sense that when you have the physical manifestations, the tremors and rigidity and that kind of stuff, ALS, another devastating one.
Yeah.
Speaking of a specialist, I had a case of an individual who we were suspecting ALS with, but nobody was comfortable giving that information to the patient over the phone. Even though the electrodiagnostic studies had shown that, and we were all able to read between the lines, even the EMG person. But we wanted a person who specialized in motor disorders, a neurologist, to be able to make that, right? And could field a lot of the follow-up questions for that. So talk a little bit about that age distribution in terms of being able to pick that up.
Yeah. With the exception of multiple sclerosis, all of these conditions increase in incidence with age. Alzheimer's, we're, usually talking about 65 and above, similar with Parkinson's. Of course, there are always exceptions. Michael J. Fox is a really good example of somebody who was, I think he was late 30s or something when he was diagnosed with Parkinson's, which is extremely rare. But all the others, it's increasing incidence with age, except MS. MS usually occurs, we usually get onset of symptoms between 20 and 40 years of age. And, that is the kind of outlier with those. We have some kind of gender differences as well. Alzheimer's disease is twice as common in women. Parkinson's is more common in men. And of course, we have the role of genetics and family history, which play a role in most of these conditions as well. ALS is one of the ones actually where there isn't much of a genetic or family history link. Does seem to be something that pops up randomly.
For someone
answer
listening,
your question.
Yeah. Leonaura, for someone listening to this podcast who is an optimizer, let's say, right? They want to know whether they have a risk factor for this. So for instance, if a cardiac history, they can get an Lp(a), they can get their ApoB, they know they have a family history, maybe of heart attacks and high calcium scores or whatever it might be on father and mother side. When it comes to maybe running down a checklist as they're listening to this podcast, what are the things that they should be looking for? Is it the genetics? Is there specific genetic testing? Is it the fact that just they're getting older or just looking at family history? What would you say?
Yeah. We're all getting older. I think it's really important to know, especially with the top three of these, the disease process is beginning decades before diagnosis, which is a good thing in a lot of ways because it does give us a big window of opportunity to make the lifestyle changes that we're going to come on and talk about. The different, and interestingly, with neurodegenerative diseases, the research is still probably in its infancy as to, in exactly what is going on with a lot of these diseases. Alzheimer's being a really good example. We know about tau protein and amyloid, but every intervention that's been tried to reduce these things does not reduce Alzheimer's. So it's, we have these kind of markers, but we don't, they seem to not make a difference when we make changes with them, when we have drugs that are reducing them. There are some genetic tests that can be done. There's one, for example, with Alzheimer's disease that's called ApoE4 or ApoE. You have the test done and then it tells you what your profile is. And this does give, if you're homozygous for ApoE4, then you have a dramatically increased risk of developing Alzheimer's. But the problem with the testing is that it tends to just make people really anxious without being helpful. And I actually think it's more helpful to come from the perspective of saying that we're all at risk of these diseases, and therefore we should be doing everything we can from as young as we can to have a healthy brain and therefore reduce our risk going forward. Does that make sense?
Yeah, I think maybe a lot of our listeners, I know we've referenced that series Limitless with Chris Hemsworth.
Yeah.
Are you familiar with that? Yeah.
Yeah.
I think it came out about a year ago, and maybe towards sometime fall of 2023. Really good stuff. But one of the things that came from that is, he had this $1 million workup because the whole idea is about longevity and, brain health is very important. I think Peter Attia's in there too. Yeah. And it turns out that he's homozygous. So he's got the 2 pairs of ApoE4, if I remember correctly. And a lot of people went onto social media, a lot of well-known physicians, and just completely destroyed the whole approach about, hey, why would you add this? This is a guy, I think at the time he might have been 38 years old in the prime of his career. And, at least behind the camera, it looked like he was really taking it hard, as it should be. Because I think his father also has Alzheimer's, and it really changes your perspective and how you start looking at life and reevaluating. To make matters worse, of course, he's very popular. This Thor and Marvel's Avengers, that's my favorite superhero there. Yeah. And he's talking about, I'm going to take a break from acting for a little while to be able to spend this. All seemingly because based off this testing. And so I think that really adds to your point in terms of these tests aren't without harm. Putting aside the cost, no idea how much ApoE4 gene testing costs, probably not that much. The anxiety and then the further, downstream testing that comes from that. And that can have profound effects, not only on the individual, their families, the system, and cause just burden in general. And so that's something really important for us to consider. Darsh and I were physiatrists, we're musculoskeletal docs, we're also maybe neurodocs in some sense, but we look at the whole picture. And so this is certainly something that we're going to be ordering when appropriate, looking at. Yeah. But nowadays, actually, because of this consumer-driven healthcare system we're in, everybody has access to this. Because I think if you get your 23andMe or any of those genetic stuff, like you'll have access to that data. You'll be able to see if you have an ApoE, I think it's ApoE4, if I remember correctly.
Yeah, right? That's correct. Yeah.
So I think that's something really important and for us to be mindful of.
Yeah. And I think, like I mentioned earlier, I think the potential risk of harm, it's, there's debate about having all of this genetic testing done. What do you do? What do you do with it? Does it just make you terrified and, become very obsessed, and end up not living a normal life? And there's been examples of people who have, for example, who have bilateral mastectomies because they find that they are at risk of breast cancer when they don't have breast cancer. To me, that seems to be going too far, and there is a high risk of causing harm. And I think with, if somebody already has symptoms or they have a very strong family history, then I think you could make an argument for doing some of the genetic testing. There's genetic testing for Parkinson's as well. But even if your test comes back negative, with especially with the common ones, it doesn't mean you're not going to get them because they're multifactorial. All of these things are multifactorial. And I'd love to share with you Daniel Amen, who I am trained as a brain health coach and trainer. He's done some really fascinating, he does SPECT scans, and he's found that there are 11 things that are frequently associated with increased risk. Is it okay if I share them?
Please.
So number 1 is blood flow. And even, often we think with Alzheimer's, this isn't, a disease of reduced blood flow, but it turns out that it is. And people who have cardiovascular disease, they are dramatically at increased risk of Alzheimer's. The brain is a really greedy organ. It is only 2% of our body's weight, so it's pretty tiny. I have a brain model. I meant to get it out. I won't get it out now. But it's pretty tiny. You could hold it in the palm of your hand. And it uses 25 to 30% of all of your resources. So if it's not getting enough blood, it is going to harm the neurons and it is going to affect the functions. Blood flow is often, really underestimated. You want to, take control of your cholesterol. You want to, have your blood pressure checked regularly, that type of thing. The next thing which is really interesting is cognitive stimulation. And this is particularly a problem when people retire, that they suddenly, the stimulation that they're getting to the brain drops off a cliff. And it is really important to stay mentally stimulated, to be learning new things, to be experiencing new situations. And there is a massive increase in all of these diseases when, if people retire and stop doing anything, people, and so many people just, stop working and watch TV all day long. It's really bad for you. The next thing is inflammation. And we all know that, inflammation is at the root cause of most chronic illness. Inflammation, it particularly hits the brain hard, and it's, you'll have heard the term neuroinflammation. So that is, that is really important and probably is underlying most of these conditions also. Then we have the genes, which we've just talked about. And, here's the thing. Your genes are not your destiny. And also, not having bad genes doesn't mean you're not at risk, like we just talked about, but it's worth reiterating. The next thing is head trauma. The brain is really sensitive to trauma. As you may recall, we've got these kind of spiky bones in the temporal region. And if you have head trauma, it can cause shearing of neurons, and it dramatically increases your risk of dementia as you get older. Next, we have toxins, excessive alcohol. And, there's been a lot of debate in the last couple of years about, is it okay to have, a couple of drinks a week? I don't know the answer to that. But, alcohol is a neurotoxin, especially if it's in excess. And your body, as you're older, your body can cope less well with alcohol. And then drugs, environmental toxins. Yeah.
Sorry, yeah, I was just going to ask you about drugs. Do we know if marijuana is included in that? And is there any associated risk for dementia with marijuana use?
It is, absolutely. And Daniel Amen has some, there's some brain scans that show after chronic use, meaning like 4 years of marijuana use, you end up with large areas of holes in the brain. They're not physical holes in the brain, but they're low perfusion to parts of the brain after it's been, shown at 4 years of chronic marijuana use. The odd joint is not going to make any difference, but chronic marijuana use is not good for the brain at all. So it's a really good question. And, it's just become legal in many states in the last kind of 3 years or so. And I think it is not without risk for sure. So it's a great question. And the next thing in kind of the toxins bucket is environmental toxins. And I was actually listening to a Peter Attia podcast today. I forget the name of the woman that he was interviewing. And she was describing there's an area of the States that they call the Parkinson's belt. And it's basically a region in the Midwest where there's a lot of agriculture. And Parkinson's is double the rate of anywhere else. And it is, it is believed that this is because of the pesticides being sprayed on the fields in that area. And so that's extremely worrying for people, people who live near spraying that they have no control over at all. The next is mental health, depression, anxiety, ADHD. Unfortunately, these all harm the cognitive function in the brain. And, with anxiety and depression, if you have them for a short period of time, it's probably not going to cause much harm. But if you have it for a long period of time, you are at increased risk. And ADHD, and sadly, this worries me because I have ADHD, it doubles your risk of Alzheimer's disease, which just seems so unfair. Other mental health conditions have, and with ADHD, it's not been diagnosed for that long. So I'm sure there'll be, emerging information that comes out. It also brings up questions for me. I used to be a neurodevelopmental pediatrician. What about autism and other things like that? We do know that Down syndrome, if people with Down syndrome live long enough, they will all end up with an Alzheimer's-like disease. And that's thought to be because I think it's the ApoE gene is on the 21st chromosome. And of course, they have 3 of them.
Hey, Leonora,
really
for ADHD specifically, do we know if that's untreated ADHD or does it not matter?
I don't know the answer to that. And as far as I know from my brief bit of research on it, I don't think it's known. Yeah. And of course, I have a lot of experience with ADHD. I used to diagnose and prescribe it when I was in the UK. If you have untreated ADHD, you're at increased risk of alcoholism, drug addiction, risky behaviors, head injuries. It could be that it is untreated ADHD because it increases a lot of the risk factors that I've just been talking about. But it could also be that, it's something to do with brain function. ADHD. In ADHD, there is, the brain has trouble making enough dopamine. I don't know if it's related to that, but I think, the research on that as, there's always been people that we're like, in retrospect, they probably had ADHD. I have a family member in like my grandmother's generations. He probably had ADHD, but it hadn't been invented back then. So, that you can't do longitudinal studies to say these people who were just a bit wild had ADHD and they went on to develop dementia. So I think, that will be something that, pretty much my generation was the first generation to be diagnosed with it. So this is, we're going to find this out in probably 20 years' time. It's a really good question.
That's exactly what I was thinking, right? Because we know in Parkinson's specifically, right? So in the substantia nigra, you lose those neurons. And so we know that dopamine seems to be a very important player. And so balance of dopamine is critical. We got Dr. Heberman who will talk about his favorite with that respect, right? So I'm really curious what the research will show out to that, because the other part that gets interesting about that is if it does turn out to be, all right, the leading cause, or at least one of those, for dementia is, hey, down the road, these people are going to be suffering with these things. Okay, well, maybe we should be treating it earlier on. And if you're going to do that, you have some non-stimulant medications, but stimulants seem to work the best. We already seem to have a problem in this country, at least in the United States, of overprescription of a lot of these medications and just actually non-prescription use of these medications. And so that seems to be a real problem. So that becomes a really interesting conundrum for us 10 years down the road.
Completely. And I was really shocked when I moved to the States. So when I moved to the States, I couldn't practice medicine because it takes 4 years to retrain. And I had two kids who needed me to be at home. But I started doing a therapy called neurofeedback, and it was mainly kids on the autism spectrum and with ADHD. And I could not believe how drugged up some of these kids were. There were kids, 7 years old coming in on 5 different medications, and the last 4 would be to treat the side effects of the first one. And in the UK, we just wouldn't have done that, partially because of rationing. One of the good things that comes out of rationing of services is that you're very careful about what you prescribe, and you very rarely stack, multiple medications. You will try something and then you'll try something else. But I was horrified when I moved here by how overly medicated children were. And also that some kids who, I really felt probably didn't have ADHD, who would maybe just, a bit rambunctious and, had a lot of energy, were because teachers were complaining about the child were being diagnosed. And I think, that makes me sad. And I think it's really inappropriate and needs to be watched very carefully. But the medications I used to see this all the time, for people who truly do have ADHD, the medication can be magical. It really can. It can turn a child's world around.
Yeah.
Yeah. So great questions. Thank you.
So sorry, we cut you off. I think you keep going. I think you're number 7,
indeed.
right?
Yeah. So next is immunity and infections, autoimmune disease. As you probably all remember from medical school, MS is one of the ones where it's believed that there might be an autoimmune component to it. And it is more common in people with other illnesses like Hashimoto's thyroiditis often goes alongside MS. And then, of course, we have infections and things like chronic Lyme disease. We used to have syphilis, not so common anymore. And sadly, this worries me also personally, COVID. And we don't know what the impact is going to be. We have a lot of people, who have long COVID, who are, 3 years on, still not recovering their brain function back to normal. And so we are not going to know for years to come the impact on neurodegenerative diseases of the brain inflammation that came alongside COVID for some people. So that's, interesting. Yeah.
Just to add to that, Ultimate and I did an episode actually on long COVID and kind of the leading theories. And I think one of the most leading theory was that there was low serotonin in the gut from the vector of the virus. And so when we think of the gut-brain axis, I wonder how much of that, the gut playing a role, with serotonin and the brain. But yeah, like you said, I think we're gonna find out more.
And we know that, COVID was causing neuroinflammation from the loss of sense and smell. And interestingly, one of the things that is done in neurocognitive testing is testing the sense of smell, because it is one of the earliest signs, certainly of Alzheimer's disease. And, I lost my sense of smell and taste for at least 5 months, and I'm not sure that it's fully recovered. I don't actually drink alcohol anymore, but I did a wine tasting and just sipped and spat. And I could not really tell the difference. I'm like, I know it's red wine, but and there are some people. I have a friend who 3 years on really does not have much of a sense of taste and smell. And that is something happening in the brain. That's not in the nose. It's not in the mouth. That's in the brain.
Wow. So would you relate that as well to the second point of cognitive stimulation? Because we know those who start to lose their hearing also are at an increased risk of dementia. So is it just any type of sensory input that we see?
It totally is. And actually this podcast I was listening to with Peter Attia, the neuro psychiatrist he was interviewing, said that what the theory is that when you are losing your hearing or your sight or your smell or your taste, the part of the brain that, that those senses go to becomes understimulated. And therefore, the neurons start to die just because they're not being used. Fascinating stuff. Yeah. So the next things, neurohormones and, hormonal imbalances. And we all know, I think the most famous one that we learn about in medical school and that everybody's obsessed about paying attention to is thyroid. We know that thyroid hormone, both low and high, affects, brain function, affects your energy levels, how you feel, etc. But of course, then, we have other hormones as well. And there is a very strong association with particularly Alzheimer's disease incident dramatically increasing after menopause. And, clearly we've got, all the female hormones are dropping. And we also know that treatment of menopause with hormone replacement therapy slows the progression. So that's really interesting too. And again, something that I think is in its infancy in the research, but we're going to know more on that going forward. The next thing is what Daniel Amen and I think Mark Hyman call diabesity. And this is the combination of obesity, insulin insensitivity, and diabetes. And this has all been associated with brain size and function. And I heard something the other day. They found that if they give a spray of insulin up the nose so that it goes straight into the brain, it can improve cognitive function in the short term. So there's definitely something going on with insulin that is dramatically impacting brain function. And, the bad news for people who are overweight, and believe me, I completely understand this. 2 years ago, I lost 53 pounds. I was really struggling to get my weight under control. It's not easy. And I really feel for anybody who is struggling with their weight. It sadly has a really big impact on your brain. And Daniel Amen has found that it leads to an overall shrinking of brain size if you are in the obese range or higher. And, that is definitely something that's worth getting under control. People with type 1 diabetes have a much higher risk of Alzheimer's disease. And then the final one, which is actually one of my favorites, is sleep. Sleep is when our brain is restoring, regenerating, and the glymphatic system was discovered, I can't remember how long ago, but really fascinating when it was. And I tell, people when I work with them, it's like a cleaning crew comes into your brain at night and puts everything, they're a tidying crew as well. They put everything back where it's meant to go. It cleans away the waste so that, when you wake up in the morning, your brain is fresh and ready to go. And so sleep, if you're not getting adequate REM and deep sleep, your brain may not be getting that proper cleaning going on. And that is likely to lead to neuroinflammation and other risk factors as well. So poor sleep and it's not an easy thing to deal with. It's something that I struggle with, but sleep is incredibly important for brain health.
And I think
go ahead.
No, sorry, just to build up on that. And, at the risk of making this an entire podcast about sleep, I think what's even more fascinating as we continue to learn about the different stages of sleep, right? So people are familiar with non-REM and REM sleep, but even within the non-REM sleep, you have multiple stages. And we know that deep sleep, in stage 3 sleep is critical when we're talking about physical recovery. We talk about growth hormone releases is going to be quite high. So if you're training and exerting yourself at a high level from a physical recovery standpoint, that is very important. And that tends to be earlier in the night, right? When, first couple of hours that you're going to get into. What's interesting, I remember coming across a study, and I'll have to find it so we can put it in the show notes, is, individuals that are deprived specifically of REM sleep tend to have worse mental health, right? And so that suggests that, different stages, as we know, are responsible for different parts of recovery and health in general, and just your overall brain health. And so it's just fascinating.
It really is.
Yeah, I wanted to mention
sleep
that too.
Science is amazing. And anybody who's into sleep, Matthew Walker's book, and Huberman has had Matthew Walker on several times. He has an amazing book called Why We Sleep, and it goes really deep and nerdy into the science of sleep. But again, it's a relatively new field with, new research coming out all the time, and it's absolutely fascinating. I've mentioned that I'm 56. When I was a young doctor, we did not know that sleep was important. It sounds crazy. And, and certainly amongst medical professionals, it was like, I'll sleep when I'm dead type of thing. And, everybody used to make a joke and be proud. I've only had 4 hours sleep in the last week type of thing. And I look back and I'm like horrified by it because goodness knows what damage it did. So fascinating.
Yeah. And it's not, I know you're talking like that was a long time ago. That was happening. I think that book came out in 2021, maybe. And that really put the importance of sleep, made it more mainstream for people.
Yeah.
And so he should definitely be accredited for making it a conversation among people more often, particularly healthcare practitioners.
Yes.
But I think that hustle culture and just sleep being the first thing to go, it's highly prevalent even today.
Yeah. Yeah.
I know he has his biases, and he'll talk about, and this is a quote, he says, sleep is the elixir of life, as he says. Yeah. For certain people, absolutely. But for others, they have other lower hanging fruit that's going to have, as Charles Duhigg says, keystone habits. And if you change those, they're going to have more ripple effects, and so,
yes,
but goes without saying, sleep is absolutely critical. Darsh, did you have something? Because I wanted to follow up on something specific about this list and recap for the listeners.
Go ahead. I was going to say exactly what you said about the stages. So yeah.
Awesome. So let me just recap for you because I wrote this down. This is awesome. So you talked about blood flow, right? Number one, we talked about cognitive stimulation, sensory input coming from different places and continue to challenge that. We talked about inflammation and neuroinflammation in general. We talked about genetics, head trauma. That's the part that concerns me with all the football and stuff. Excessive substance use, exogenous substance, alcohol in particular, but even marijuana and environmental toxins, mental health, depression, anxiety, ADHD in particular, autoimmune diseases and infections, which we're learning more about, the neuroendocrine system, which is fascinating as well, and neurotransmitters and their effect down into other hormones, diabetes or just metabolic syndrome, I would take it even broader to that and talk about that. And then last but not least, sleep. Did we get all of it?
Yes, absolutely.
Awesome.
Absolutely. And this just popped into my mind when you were talking about it. I think another really emerging field right now is gut health and the microbiome. And, talking about neurohormones, we now know that, I can't remember the percentage, but it's really high, of serotonin is produced in the gut by the microbiome. Yeah, by the microbiome, we need, and this is just another reason why we need to be focusing on having a healthy diet. But again, I think the research on that is just emerging, and it's going to be fascinating to find what comes out from that research.
Yeah. So a little while back, before we started the list, we were talking about the role of genetics, particularly. I think Darsh had brought up what we think the role might be for people who are very much into being active participants in their care, and they want to optimize per se, or just consider preventative measures, right? Early, we talked about the diseases starts decades before we even diagnose. And so what can I do as an individual to mitigate the risks of this happening, particularly if there's some family history there?
Yeah.
And so, that building in with what I had mentioned earlier about the role of looking at some of this genetic testing, what do we end up doing for this? And I'm curious what your specific thoughts are about that. I know you were practicing for a long time, and like, how do you look at that problem? And is that something that you would advise your closest family members, loved ones to get that done? Or do you think it does cause more harm than good?
I think on balance, for me, it causes more harm than good. I think unless, you have a lot of risk factors and you want to be certain. But I would say even if you have a lot of risk factors, you should be taking this really seriously. Anyway, even if all you have is risk factors and you don't know your genetic profile. I think there's just so much uncertainty around that. I think it could definitely do more harm than good. But it's a personal decision. If you want to know all of your genetic risks, then go for it. But you must make sure that you get proper counseling about that, because you're likely to find that you're at risk of several of the chronic illnesses, because we all are. Yeah. And when I trained as a doctor, we were told your genes were your destiny. And we now know that not to be true. Many disease-promoting genes have an on and off switch. And what can switch them on and off is lifestyle change. And when I work mainly as a coach now, and I do trainings on brain health and stuff like that. And what I like to tell people is think of health as being a balancing act. It's a balance. You have health liabilities. So these are these are your risk factors. These are the things that are bad for your health, and the things that you might be doing in your lifestyle that are potentially bad for your health. And then we have health assets. Now, you probably can't be doing everything to mean that your health assets are, right up here and you have no health liabilities. But I think the sensible approach is to say, what simple things can you do to tip the balance in your favor? I think we all know people. I had a friend who died at 24 of our friendship group. She died of adult sudden death syndrome. Like, they couldn't find anything wrong with her. She just died in her sleep. It was devastating. She was the healthiest of all of our friendship group. She was an athlete. She ate well. I think she was vegetarian, maybe even vegan. And she bet on somebody to live to be 105, it would have been her. And, health is unpredictable. And what you should focus on is tipping the balance in your favor. Does that make sense? I believe that to be a sensible approach, because I think you can become very stressed and obsessive about it and as we all know, stress is really bad for you. Stress increases inflammation. And, don't get stressed about this, but take actions every day to tip the balance in your favor. And I also recommend that people start with the basics. Do the things that are easy to do and where there's the most research. And so the top thing, especially when it comes to neurodegenerative disease, is exercise. Peter Attia, calls exercise the most potent longevity drug. He says, there is no other intervention that does nearly as much to prolong our lifespan and preserve our cognitive health. As strong as words from a medical expert can get. So exercise is key. And he says, we want to be a decathlete when it comes to exercise. You want to be doing lots of different things. Don't just be, a long distance runner. Don't just be, a cyclist. You want to do a little bit of all of the different types of exercise. Aerobic is really important, strength training. And, in the last couple of years, the research on strength training and muscle mass as we get older, it's really important to optimize your muscle mass as you get older. So many reasons. But then we also need to do the balance exercises as well, because you could be a bodybuilder and have big muscles, but you have very poor balance and you fall and you break something and then you can't work out anymore. And that is, that's going to be a big problem. So exercise is if you only change one thing, try and get more exercise every day. Does that make sense?
Absolutely. And I think it's a great point that you make about being diverse in your exercise sets, because a lot of people might hear, oh, well, the number one cause is blood flow. That means I have to double down on cardio. That's it. That's all I have to do. But wait, let's not forget that weightlifting can help hormones, help the obesity issue, go hand in hand with a lot of the other exercises. You talk about stimulation from doing balance, maybe hand-eye coordination. We know racket sports, tennis, pickleball, those sports typically have the highest correlation longevity. And, having fun and being able to be diverse, I think, is critical.
It really is. Absolutely. One of my favorite reasons for exercising is brain-derived neurotropic factor, which I'm sure many of your listeners will have heard of. But it's this cool neurochemical, and it basically, when you exercise, it produces brain-derived neurotropic factor. I think your muscles produce it. And it stimulates the hippocampus and primes it for learning. A really great combination, if you want to optimize brain health, is to exercise, then meditate, so you calm your nervous system down, and then learn new things. That's a brilliant combination for kind of optimizing new learning. So that's one of my favorite tidbits. Anything else that we want to discuss about exercise, because and you guys are experts in this. It's a huge field and it's super important.
No, I think maybe if you do counsel somebody, and sounds like that's a good place to start. If we were just making blanket statement, which is the best that we could do, not having a person in front of us in their individual situation, what dose, right? So we talked about different movements, but the dose also matters, just like any medication. Completely.
The kind of Attia says, 90 minutes a week or more, as much as you can get while still doing all of the other things that you need to do in your life. 90 minutes a day, I think, reduces your risk of, if you go from 0 to 90 minutes a week, it decreases your risk of Alzheimer's by 14% just from doing that one thing. And of course, people, when they're exercising, also tend to, it's like a keystone habit, like you mentioned earlier, they also tend to then improve other things as well. It's, because they're exercising, they might notice that, food is affecting them more, or they might decide that, they want to eat a healthier diet. So it's a really great place to start. And I think, you guys work in kind of the rehab setting. You have to start where you are and very gradually work up. The last thing you want to do is go from 0 to, doing a 90-minute intensive Zumba class and having a heart attack or injuring yourself. You want to do it slowly. My favorite tool that I've discovered recently, I have Ehlers-Danlos syndrome, so I have very lax hip joints, and I've been told that I mustn't run. And so I have started walking with a weighted vest, and I'm now up to 16 pounds of weighted vest. And I have a hill behind my house. So I do 30 minutes every day of walking up and down this hill. My husband thinks it's the most boring thing on the planet. What are you doing? You do not get bored. And I'm like, I don't care. I'm walking up and down hills with a weighted vest on. But for some people, even that would be too much. Start where you're at. If you have existing health problems, you have to check in with your doctor before you start any exercise. Otherwise, there's a high chance that you're going to do more harm than good.
Is that your mode for aerobic or zone 2 training?
Yeah, that's for me. Yeah, absolutely. And I do a bit of Peloton as well, but I don't like it, but I love walking outside. And, the other benefit of walking outside, even in the winter, is sunlight, which, increases your natural vitamin D. And it also helps regulate your melatonin levels. So it increases your chances of getting a good night's sleep. Huberman's very obsessed about that. And I've become obsessed about it too. Even, I'll try and even get outside if it's raining, because there's still some daylight to be got, and getting that into the back of your eyes in the morning is really important.
Yeah. And I think that's a key point right there. The timing of that is critical. So getting early sunlight is very important in terms of regulating your circadian biology. And, coming back to that point about exercise you're talking about and how it has ripple effects, I think another key point, we talked about sleep, right? That's one of the 11 that you have. Is we know that you need to have adequate buildup of adenosine in your body. One of the prime ways to increase that adenosine in your body is how much activity you've done throughout the day. So by exercise, getting steps, being just more mobile throughout the day, you build up enough adenosine, and then you're going to have a better quality sleep throughout the night. As long as you're not consuming a lot of caffeine, which is an antagonist for that, and other drugs and whatnot might you have. And again, that's probably the two most important things when I will counsel my patients. I will do a lot of coaching, and we'll do this lifestyle medicine approach. We talk about the pillars that multiple guests have talked about. That most recent guest also talked about those, and we'll typically look at one of those: sleep or exercise. You talked about stress management and inflammation as well. Again, two amazing medicines, exercise and sleep, to help with stress as well. And all these things are just intertwined so tightly, and they're coupled that when you tend to focus on one, which might be different for a different individual, of what's going to have the biggest bang for buck and the greatest ROI, it tends to work out pretty well. Yeah.
And one last thing to say about exercise, you have to see it as an investment. Yes, it is time consuming to do exercise, but you will get that time back multiple times over with increased health span, with being fitter and healthier and reducing your risk of falls and dementia, all these things that we've been talking about. I would, if you're struggling with exercise, I would recommend that people start to see it as an investment, and that can change things around.
Yeah, that's the buzzword, the word that we love, health span, right? We're very good at extending lifespan and dragging people through the finish line. I use that, whatever that means, as the last couple of years of your life. And Darsh more so now than sees people in the rehab setting, and they're not very mobile. And so last 10, 20 years of what does that look like? And so I think being, Mike Estertel recently talked about this on Chris Williamson's podcast about you have the mortality piece of it, which modern medicine phenomenal at, the morbidity piece, not so good. And so again, things like exercise are giving you options as life, extremely valuable. Something my colleague here is phenomenal at, particularly when we talked about, all the places that he likes to visit and how important that is to be able to enjoy those vacations when you have to do, I don't know, what was it when you had to do like 1,000 steps? Darsh, was that Portugal or wherever you went, like where you have a bunch of steps, and if you're not fit and you don't have the requisite muscle mass, you're not getting the most out of that vacation.
Totally. I had an incident a couple of years back getting on a plane, and there was a lady probably in her 60s who was in the seat next to me, and she couldn't even manage any of her baggage. Like, she had a wheelie, suitcase and a backpack. She could barely drag them, and she certainly couldn't lift them into the overhead, compartment. And I remember thinking, I want to be able to lift my own bag up. It's a funny thing to get obsessed about. It led me to start doing more arm exercises. It's really important. You want to be able to keep up with your friends and family.
Yeah, or be able to run through the airport when you have a short layover with the bags.
Absolutely.
So,
just to bring back Tia, because I know we mentioned his name a lot. He talks about this when he had a recent trip to Italy with the family for a wedding. And, they had to run to the train on cobblestones. If you take your training and you think about what is it going to take for that dream vacation, a lot of people want to go to Italy, a lot of people want to go to countries. Well, how do you have to train to do that? Is it steps? Is it the strength training? Is it the ballads? It's lifting overhead? So those are the types of things that I even talk to my patients about, when it comes to rehab. It's yes, you're going to the gym and you might not be motivated. Hey, guess what's going to motivate you? Thinking about how these exercises translate to your everyday living, to your, occupation, et cetera.
Yeah. And I think therein lies, one of the big problems with prevention is complacency when you're healthy. It's hard we call it in coaching, it's hard to future pace to a time when you're not going to be healthy when you are healthy. And I think that's why, we, especially as physicians, we all know the things that we should be doing. So why is it that most people are not doing it? And it largely comes down to complacency. And that is a hard thing to overcome if you feel fit and healthy right now. And, so that is definitely a challenge. Yeah.
Awesome. So we've stressed the importance of sleep. We've talked about exercise. And I think these are the pillars that we've addressed multiple times before. I'd like to shift to talking about just your nutrition and diet. Right. I think when I look at this list that you created for us or you give to us today, I look at inflammation, I look at diabetes, obesity, and I put them together just because metabolic syndrome and metabolic health is turning out to be such an interesting thing in terms of how it affects, for our field, specifically when we talk about musculoskeletal health and pain, we're now starting to learn that individuals who have poor metabolic health, not only are they more predisposed to tendon-related injuries and just pain in general, but they also don't respond as well when we're offering some of those treatments that we've talked about on this show quite a bit is something called PRP, orthobiologics, regenerative medicine. Some people might recognize it. I'll tell you anecdotally from my own experience, like drawing somebody's blood who has poor metabolic health and then spitting that and injecting it back in versus healthy individuals, it's visible to the naked eye in terms of how the quality of that product looks, right? And we even have evidence on this. I think came across a study which looked at adipose-derived, quote unquote, stem cells and individuals who were obese characterized by BMI versus people who were not tended to do a lot worse with these treatment modalities, right, for musculoskeletal conditions. And, I'm digressing a little bit, but I think it does stress the importance of how important it is to dial that in. And so with that said, how do you look at just metabolic health and controlling that and in terms of the role in brain health?
Yeah. Back to the old, I'm forgetting who it came from, but it's an ancient philosopher, food is medicine. And, what we eat fuels every cell in your body. And going back to talking about neurodegenerative disease, like I mentioned earlier, the brain is a really greedy organ. So and it's even more sensitive than most of the rest of the body to what you eat, but it's all sensitive to it. I think, thinking about diet, I am a big believer in personalizing diet. I think there isn't one size fits all, but I think there are some basic rules that, are backed up by, pretty strong science that tells us, for example, limit processed food and sugar. These cause inflammation and all sorts of other things. And they are ultimately bad for you. I think give me a nod if you think there's a consensus on that. I think it's also important to, eat lots of fruits and vegetables. I did this weight loss program a couple of years ago, and a rule that I found really useful is to eat at least 10 ounces of fruits and vegetables with every meal. And I've always thought of myself as a pretty healthy eater, but that's quite a lot of volume. I remember my husband saying, "You're eating so much now." And it was just, these huge mountains of vegetables. But, they give fruits and vegetables give you slow-release carbohydrates. They are giving you fiber, which is important for gut health and the microbiome, like we talked about earlier. And if you eat from the rainbow, so eating lots of different colors, you're getting all the micronutrients that are necessary for healthy cell function. Fruits and vegetables, super important. Eating clean, lean protein, it's become very popular still. Most people are not doing that. Healthy fats, fish oil, avocados, olive oil, and drinking plenty of water. And those are my basic rules. We could go much deeper, but I think, I like to keep it simple. If you go online, you can get so confused about nutrition. And if you just create some simple rules that you can stick to, I believe it's so much easier to follow.
I find it so funny that you're talking about 10 ounces. We've had a multiple time guest here, E.C. Sinkowski. I think you really find her work really awesome, who talks about the 800 gram challenge and consuming, fruits and vegetables and 800 grams a day. Can you guess what 10 ounces, if we say it 3 times a day, what that equates to in grams?
I'm going to have to go with 800.
It's about 850. Yeah. So I find that really, really interesting about that dose. That is. And again, this comes back from actual studies, and EC's talked about this. I should add to that. I remember sending her, there was an updated study that actually came out that 90% of that benefit you can actually even get from 400 grams a day. And we'll put that in the show notes. Obviously, we don't always like to say more is better, but probably 800 grams from a volume standpoint, just by, subtraction by addition, we have talked about. So if you end up putting that much volume of fruits and vegetables, you have a little bit less space in your stomach for the crap, right? This ultra processed food and stuff that tends to increase the inflammation. So I still think that's probably a better strategy for majority of the people, not everybody, but a lot of people.
That is good to know. That is just because it's sometimes pretty hard to eat. And you have to get creative getting that much.
And I'll encourage people to, again, follow her on social media because she does a phenomenal job actually sharing the meals and showing that in comparison to what a plate of 200 grams looks like, right? Or ounces, however you want to look at that. And so I think that's just really interesting too.
Amazing.
Yeah. What about something that we're interested in, right? Because we like exercise and stuff. And, there's a lot of interesting stuff coming about in terms of different supplementation, particularly in creatine as being this panacea almost when it comes to brain health. The benefits on muscle and strength are well purported. The most researched supplement, probably with the exception of caffeine, but maybe even more to just athletes and sports and just health in general. But we're seeing a lot of interesting stuff with mental health and brain health with creatine. What can you tell us about that?
Yeah. So I knew you were going to ask me about this, so I had to go and research it because I didn't really know if there was a link between it. But it's emerging, in the scientific literature. But it does seem that creatine probably has neuroprotective benefits in Alzheimer's, Parkinson's, and Huntington's. And they think that it's because of its role in improving cellular energy homeostasis, the balance of energy production in the individual cells. And it is also theorized that it improves mitochondrial function, reduces oxidative stress, and inhibits apoptosis. I think that the exact mechanism, it's probably going to be multifactorial, like most things are, but it's really interesting. And I think in the next few years, we're going to start to see, more compelling. The research right now, I think, it is in that emerging stage. And with regard to neuro health is, it's in the balance right now, but it's looking really hopeful.
Do you know what dosages were used in the research? Because from my understanding, for exercise, we pretty much say 5 grams a day, men, women. And then I was looking at Luisa Nicola's Instagram. She's a neurophysiologist, and she's really been promoting creatine. I believe she was saying about 10 to 15, maybe to get the brain health benefits. Is that on par with what you're reading?
I don't know about the dosage. I'd have to look deeper into that.
Gotcha.
Okay. Yeah.
Awesome.
Fascinating.
Yeah.
All these wonderful things coming out that, and it's an easy supplement to take. I take it every morning myself in a shake. Don't know that I particularly see, much change in it, but I'm willing to trust the research on it. And especially with muscle, going back to what we were saying about muscle mass being highly protective as we age. If that's the only reason to take it, then that's a very good one too.
Yeah, just to actually follow up, I just pulled up a study here, and in it they're looking at, actually, it's even higher, Darsh. So here at, the 11 studies, 3 of them showed that about 20 grams a day for anywhere from 7 to 28 days seemed to have a positive effect. A lot of heterogeneity between these studies, but all in all, that's the doses they're looking at. And this, again, we'll put this in the show notes. This is a paper from Brain Science published in 2023. So pretty recent, actually. First author is Moriarty. So interesting, much higher than I would have anticipated.
That's a lot. That's
loading dose.
Yeah, you got to work up to that though, from like the gut perspective too. I'm sure a lot of people have gut intolerance at that high of a dose.
Yeah, not everybody, gut or just kind of retention, water retention. Not everybody seems to have that stuff, but yes, at the higher doses, you do. So interesting.
Fascinating. Watch the space.
Yeah. Leonaura, what do you think it makes sense to go next from here in terms of putting a framework? I know there's a lot of areas we can go, and this is a full seminar. In terms of practical things, one of the things that we love to do is give people something that they can take away from this and implement relatively quickly in their lives just to improve. And we've stressed the importance of exercise. We talked about sleep. We've talked about just being mindful. And, you gave the number of eating sufficient amount of fruits and vegetables. Where do you think it makes sense to go next in terms of things that it carries a lot of bang for buck, so to speak?
I think for me, the other really important piece of the puzzle is stress management. And this kind of overlaps with mindfulness practice. I think, many people, and I particularly worry for people in the medical profession where stress is very high. My own podcast, the aim of it is to reduce burnout, because burnout is extremely high, in medicine and in other professions like law. And, I think learning to manage stress, to become more emotionally aware and to be able to regulate your emotions is hugely important and a little bit underestimated. So happy to go there if you guys are interested.
Yeah, please.
Yeah, that's something I'm very bad at. So I'm all ears.
Yes, absolutely. Absolutely. And I think, mindfulness practice does fall, into this umbrella. I once had a coaching client, and I was talking to him about mindfulness practice. And he said to me, the only thing that relaxes me is getting on my motorbike and driving on country lanes. Is that okay? And I'm like, if that does it for you, then go for it. And I think, for a lot of bright people who have a busy brain, the thought of having to sit and meditate for, 30 minutes and empty your mind it's very daunting. And I think, we need to get away from that image of mindfulness practice. For me, mindfulness practice is any practice that teaches a person to become more aware of the state of their mind and their emotions and to learn to consciously control it. And the result, if you can find a practice that works for you, is better emotional regulation, less stress. And also, there's a brilliant book called Peak Mind that came out a couple of years ago, really wonderful neuroscience-y, nerdy stuff. And she found that the only reliable tool for improving focus and productivity was mindfulness practice. And which was really, she didn't want that to be the answer to her question of what improves focus and attention and productivity. She wanted it to be something else, but turned out to be mindfulness practice. And, it has no side effects. It is extremely portable. You can do it anywhere. And I personally believe that there is a mindfulness practice out there for everybody. And there are some wonderful tactile mindfulness practices that when I'm teaching it for my high-performing, busy-minded clients, I always get them to start with the tactile one. And, you can do it. I get really grumpy when I'm driving and people cut me up, or there's a red light when I'm in a hurry or whatever. And I do this tactile mindfulness practice and it immediately calms me down. If you've tried mindfulness practice and you've not had any success with it, I would highly recommend you continue looking. There are, there's a million different things that you can try on YouTube or, many other platforms these days. But it is such a powerful tool that, like I say, has no side effects really, that I think everybody should have a mindfulness practice in their lives.
I got to ask you this. So mindfulness has this connotation of a solo practice where you can build social intelligence, emotional intelligence, like you said. Ultimash, I think, what was it, yesterday, sent me an Instagram post about 11, different statements that somebody with high emotional intelligence can say. And, some of those things were just really understanding the topic and then responding in a very pragmatic, but also allowing the other person to maybe expand on their thoughts. So saying something like, oh, that's a very interesting take. What do you think about X? So I guess my question is, does a mindfulness practice have to be solo, or can it also be practiced by communication and also in a social setting initially, which can then help regulate emotionality or build on these skills?
I do think it's a solo practice. I think you can learn it in community. Like you could go to a mindfulness class or you could but it is about going inward and learning to listen to what is going on inside. The true test of mindfulness practice is being able to use it in everyday life for people when you're in a stressful situation, for the medical professionals who are listening, when you're in clinic and a patient's, being very difficult and you're able to use your mindfulness practice in that moment, that's a true test of it. It's not meant to be just for the practice, but to get good at it, I would say you have to practice solo. Yeah. You only need 12 minutes a day. Amishi Jha's research showed 12 minutes a day is the sweet spot, and you can split it up into 2-minute blocks. So you don't have to do it all in one go. You could do maybe 4 minutes when you get up in the morning and 4 minutes after your breakfast, and to do it during, split up during the day works just as well.
Yeah, super excited. We're going to have Dr. Robin Tiger come back. She goes as the stress-free MD. You're probably familiar with her work. Yeah. And she's going to be back here for round 2. She had a great book that came out recently, and we want to talk to more about that. Darsha, that question that you asked, I'm really interesting. And I think, I probably agree with you, Leonaura. I think initially, much like anything else, you have to practice and go inward, like you talked about. I think, though, the purpose of that probably is so in your day-to-day encounters, right? You can, like, for instance, in that post that you're talking about, Darsha, it's okay, if somebody says something to you that might create some type of an emotional response and you might tend to react, you want to be able to create space between what you took in and what you're about to put back out. And mindfulness empowers you to be able to do that, right?
Yeah.
I think, though, again, as you mentioned, you want to be able to apply it to your day-to-day life. And when you do apply it on a constant basis, being mindful in those interactions, you do reinforce and you strengthen that mindfulness-based practice. So in a sense, it's like, if somebody practices for a sport and executing a play, and then they execute a play perfectly during a game, well, they've reinforced that pattern. And, that in itself is practice, right? So Vince Lombardi said, this practice doesn't make perfect, practice makes perfect. You can do perfect practice in those interactions like Darsha's talking about. So I think that's how I think about that.
And I think the last thing to say about mindfulness practice is there is no perfect in mindfulness practice. It is, I think even, regular meditators will have sometimes that they practice where, 90% of the time they're distracted and thinking about other things. They're like, they're being distracted by squirrels. But the more you do it, the more you'll have more time, actually in a mindful, present, healing state. Yeah.
Awesome. Love that. I want to ask you, Luna, out of some of these things that we've talked about, what do you struggle with the most personally?
For me, it is sleep, and it's really frustrating because, I've tried everything that I can think of. And
as in you have trouble going to sleep or staying asleep?
I have trouble staying asleep. And it worries me from a brain health perspective that I have trouble staying asleep. And I think, it's my age, and I have some problems with reflux that's not caused by bad diet. And it frustrates me because I'm like, I feel like I'm doing most other things right. And I, no matter what I do, it doesn't seem to improve my sleep.
What comes the easiest to you?
Now, diet. For many years, that was not the case. I really struggled. I was a food addict for many years, and I am now in control of that. And I now have a very healthy relationship with food. And, I'm very comfortably able to, unhealthy food, I look at it now and it's not food to me. If you offered me a can of dog food, I would say I don't eat dog food. And I'm able to look at, highly processed, sugary food and say, I do not eat that. And that's been really profoundly helpful for me.
Okay, the last of the trio of questions there. What do you spend most of your energy working on? I know you said sleep frustrates you the most, but is that what you're working on the most?
From my own health perspective, my other struggle is exercise. I struggle to make time for it. I love working and I love, I love coaching and I love creating content and like educating people. And so I often deprioritize exercise. I do at least 30 minutes a day, but I know that I need to be doing more.
Yeah.
And, I struggle with that a bit. So really wish I didn't.
Yeah, I'm thinking about actually the parallels to, again, coming back to that, the question I asked you about ordering some of these genetic markers and what that means, right? So a different example in the realm of cardiovascular disease. So we've talked about Lp(a) quite a bit with multiple clinicians who've come on in the past. And we know that there's a strong relationship with elevated levels of Lp(a) and adverse cardiovascular health.
Yes.
But the problem is that thus far, at least in the primary prevention, there's really not much you can do. There's nothing you can do, right? Down the street, have these things called ASOs that might be available. At this point, there's stage 3 for just people who are tertiary prevention or secondary prevention. But the argument that I make with individuals is that if you do know that you have certain risk factors, so either Lp(a) elevated or 2 alleles of ApoE4, there's nothing to do about those specific things. And sure, it might cause a little bit of anxiety, but what you can do is you can double and triple down on everything else that you can control, right? Yeah. So for instance, in the cardiovascular stuff, maybe you can get your ApoB and LDL and better. Maybe you can manage blood pressure and you can really take those things seriously. Same thing with respect to brain health, right? Maybe now you can really, it can almost quote unquote light a fire under someone's ass to really take their sleep seriously, to really focus on exercise, to really focus on all the other things and not freak out. But I think that's really important, right? That's where you have to sit down and in front of the patient and you have to figure out, is this the person who is going to actually be empowered to know, oh my God, I need to seriously, and that could be a really powerful coaching tactic. Or is this the person who is going to, that knowledge is going to be so burdensome that they'll actually crumble and get more stressed out. I think that part is really important.
Yeah.
And so when I personally had these conversations with some clinicians about ordering these things or doing that stuff, or actually even ordering it in my practice, and they're like, well, there's no role for that because you can't do anything about it. Well, yeah, maybe not directly, but you can use that to do things for other things, right?
Sure.
And I bring that back to the conversation you're having. And I was thinking about that as, okay, if you say that you struggle with sleep, is this something that you double down on your strengths, which is diet? And again, my friend here likes to talk about this. He likes to take the contrary point of view, is like doubling down on your strengths rather than focusing on your weaknesses.
Sure.
And I find that to be interesting.
Yeah, absolutely. Yeah, it's a difficult one. And I think, it's so dependent on the person and the stage of life they're at. There's been times that if I'd been, told I was at genetic risk, that I would have totally freaked out and it would have made me ill. And there's other times when I would have been totally empowered by that and become really determined and being, like you said, I'd be like, okay, now I'm going to do everything within my power to reduce my other risks. And I think it all comes down to helping people find their own leverage. I think this is a kind of a coaching term, finding what is it that motivates them. And sometimes talking about the future life that people want to be living, what do you want your life to look like in 5 years' time? Do you want to be able to travel? Do you want to be able to spend time with your children or your grandchildren? And get people to envision that powerful future. That can be really helpful sometimes. And for some people, threatening them with bad outcomes can be helpful as well. It depends on the individual so much. It's a very hard question to answer.
100%. It comes out of the perspective and what the patient sees through their eyes, right? You look at Chris Hemsworth, he's got his bucket list has probably changed, right? He's probably checked off a few more things knowing that hey, he's got that homozygous ApoE4, but again, he's in that socioeconomic bracket where he can go ahead and do those things, right? So I think there's so many factors, like you said, that really the clinician has to use to determine whether those tests are useful or not. Absolutely.
And bringing up the point about money, with everything that's coming out in the longevity field, I'm trying to think of the name that I follow. Ben something. His whole thing is don't die. You guys come across him.
Yeah.
That's it. And he has this ad and it says, at one point I was taking over 100 supplements.
Mm-hmm.
Dude, how much was that costing? And, back to what I was saying about do the basics first. And then if you have money left over, sure, take some supplements and, buy yourself a sauna or whatever. But make sure, no number of saunas is going to help you overcome the fact that you never exercise or that you eat junk food all day long. Focus on the basics first. If you have resources left over, then you can go and explore some other things.
Yeah.
Does that sound like a common sense approach?
Absolutely is. That's something we always try to preach on this podcast for sure is, double down on the basics and get those in line first and then go for the small things. Awesome. Well, we definitely need to hear about your background and, coming from the UK to here and how you even got interested in brain health. I'm sure you probably have a fascinating timeline as well as stories in regards to how you got interested in this field.
Yeah. So I began my career, I was training to be a general practitioner. So I did 3 years of hospital medicine and, which included 2 medical rotations. So I was working a lot and I worked on an elderly care unit for 3 months where I was dealing with a lot of patients with these kind of neurodegenerative diseases. I have to say they were the thing that scared me the most of all of the kind of medical conditions. And so that kind of got me interested in it. And then I became a public health doctor, which back then in the UK was about prevention and improving the health of populations rather than of individuals. And it really struck me when I was working in I did a year in primary care that, we just did not have time to talk about prevention at all. We had 5 minutes per patient. You barely had time to open the door and let them sit down and you had to usher them out. So there was no prevention going on. And, so many times we were seeing people who just were taking no personal responsibility for their health. And that really bothered me. So I did, I got my master's in public health, really enjoyed that. And then I had to take a career break. Both my kids nearly died as infants and they were both really sick. And I took a career break. And during that time, I trained to be a counselor and then a coach. And when I returned to medicine, I went into neurodevelopmental pediatrics. And not to go into it too much, but by then I'd had a family member who'd been diagnosed with a condition and it got me really interested in it. I also have ADHD myself, so I was always interested in what's going on with that. And when I was a neurodevelopmental pediatrician, I got really fascinated by how differently people's brains could work. It's like how very interesting. And it occurred to me you could, brain research was totally just in its infancy then. And I would say it probably is still today. And I love learning. So a field where the learning is almost infinite really, appeals to me. And then when I moved to the US rather, I trained to do a therapy called neurofeedback. Then I trained with Daniel Amen as a brain health coach and trainer, which is all about education and preventing these illnesses and helping people have a healthy brain. And so that's what I currently do. I do coaching, help people reduce stress, become peak performers and, get their brain and body as healthy as can be. And the neuroscience, my family all, laugh about me. I'm such a neuroscience nerd. I just constantly listening to books and podcasts about neuroscience. It just totally fascinates me and I love it. And one other thing to mention, I had COVID, pneumonia and severe brain fog in 2020. I was actually almost blind for a week, which was the most terrifying thing. I had, it was like having a veil across my eyes and I had profound memory loss afterwards. I couldn't remember anybody's names. It was incredibly scary. And, I got even more obsessed with brain health there. And I started using some of the tools that I learned on myself. I'm like, I do not want this to be my life going forward. And I became very obsessive about doing everything that I can. And, I've been experimenting on myself as well. And we can prevent many of these illnesses if we fall in love with our brain and take it seriously as early as possible. And that begins today.
Absolutely.
Yeah.
Tell us a little bit about your website, your podcast, the courses you have as well, and maybe what's upcoming for you.
Yes. Wonderful. So my website is drleonaurarhodes.com. I have a funny spelling. Please read the spelling of that. And I have a couple of courses, and I have a plan to develop 12 in total on my website. My coaching platform is called Peak Life Design. And I have a program that is to help people design a life that they will love and get out of the drudgery of everyday life. I also have a course that I'm about to launch in stress management as well, which is one of my favorite topics. And earlier on in 2020, I got approached by a podcast company to do a podcast that was about preventing burnout in physicians and healthcare workers. And I had profoundly burnt out when I was working in hospitals when I was in my mid-20s. And it was a terrible time. And so when they approached me, I just leapt on the chance. I thought, what a brilliant way to reach people. And on that podcast, I interview medical practitioners about, to hear about their story and about the strategies that they use to balance their lives and to reduce stress and prevent burnout. And I absolutely love it. I love podcasting. It's really fun, isn't it?
It is fun.
So,
it is. Yeah. It's definitely fun to get together with like-minded individuals, share stories and share expertise. And, everyone comes out with a win, us as including the audience. Definitely a good time.
Yeah.
We'll definitely link your social media, your podcast, your website, all in the show notes. So that'll be easy access for the listeners there. And then we end every episode with a question for our guests. And that is, how do we put the health in healthcare?
Absolutely. So I think it begins with, from the individual perspective, taking responsibility for your own health. You have been gifted one body. You need to look after it, and you need to take that extremely seriously. And, for healthcare professionals, the World Health Organization defines health as not just the absence of disease, but being about, holistic health, body, mind, and spirit. And I think there is a sea change in the medical profession. More people are learning about holistic medicine, alternative medicine, integrative medicine, whatever you want to call it. We have to, as medical professionals, have to start seeing the whole person rather than just a bunch of organs and systems that happen to be housed in the same body.
Sure.
That is my view on that.
I love it. Leonaura, Dr. Rhodes, appreciate you taking the time out to join us. Thank you.
It's been really fun. Thank you for having me on the show.
Thanks for listening to another episode of Medicine Redefined. If you enjoyed this episode, please be sure to check out some of the additional resources in the show notes. Please also check out our social media platforms where you can find more content like this. You can follow us on Instagram, Twitter, and TikTok at MedRedefined. We also want to thank our team for the production of this podcast, specifically Ethan Ju on video, Haritha Yepori on social media, Zainab Lugmani on research, and Sarah Khan for newsletter. Oh, and if you want to get similar bite-sized information delivered to your inbox every Sunday, please be sure to sign up for our newsletter. Also, if you enjoyed this show, please be sure to subscribe, review, and share with anyone who you think will gain value from this as well. Now, time for the ever so important disclaimers. This podcast is intended for general public use and is for educational purposes only. It does not constitute the practice of medicine, nor should it be construed as medical advice. No physician-patient relationship is formed, and anything discussed in this podcast does not represent the views of our employers. We recommend that you seek the guidance of your personal physician regarding any specific health-related issues.